Hi nurses, so let's walk through to a clinical scenario together. So here the NCLEX-style question. Okay, so question is, you're caring for a patient with Addison disease. So they've been complaining of fatigue, weight loss, and dizziness throughout the shift. Now, suddenly this patient become confused, report severe abdominal pain, and you check their blood pressure, it's 78/42. So what's your first nursing action? So the choices is A. Administer IV hydrocortisone as ordered. B. Check the patient with blood glucose level. C. Place the patient in a supine position with legs elevated. D. Notify the healthcare provider immediately. Okay guys, so try to pause the question and try to answer it. Alright, so let's break this down like the nurse would do. Okay, so the patient has Addison disease, which means the adrenal gland are not producing enough cortisol. So what is cortisol is? So cortisol is a critical hormone for stress response, maintaining blood pressure, and for glucose regulations. So now, based on the scenario, you see a sudden deteriorations like hypotension, confusion, and abdominal pain. So it's all classic sign of Addisonian crisis or acute adrenal insufficiency. So what do you do now? Okay, so let's go through to the choices. Alright, so letter A, administer IV hydrocortisone as ordered. So this is the correct answer. Why? Because in Addisonian crisis, the body is in a dangerously low cortisol. So the only way to fix that and save the patient is to replace the cortisol with hydrocortisone immediately. So without it, the patient will remain in shock and it may go to a cardiac arrest. So this is a circulation issue and we are applying the ABC and addressing the physiological survival first. Okay, B. Check the patient blood glucose level. Important, yes, but is it first? No. So this is an assessment, and while the patient might be in hypoglycemic state, you don't want to delay a life-saving treatment just to gather more data. So treat the crisis and don't just collect the vitals while the patient is crashing. Okay, so letter C, place the patient in supine position with legs elevated. So again, this is a helpful intervention. And sure, we use this to support the PP in a hypotensive patients. But it's not fixing the cause. So if the cortisol is the missing piece, so elevating the leg isn't going to solve the problem. So it's a supportive but not curative. Okay, so letter D, notify the healthcare provider immediately. So this is one I see that other nurses would pick, even me. And yes, as we always want to keep the provider informed. But there's a rules in the NCLEX in real life that if there's a standing order and you can act to save the patient, just do it. So don't delay to call. So we don't call first. We treat first when we're trained and authorized to do so. Okay, so what's the takeaway from this lesson? So, in endocrine emergency like Addison crisis, you've got to act fast, replace what's missing, and prioritize circulation. So, think ABC and Maslow and safety, and always ask yourself that will be the actual fix the problem. Yeah, thank you guys.